Hi YouTube. Um, this is Sean Perceive After Loss. I did say that my channel name would change. Once I hit the second trimester, and I know that everything is okay. So for right now, it's still Trying to Conceive After Loss. But I will update you of my channel name change. I'm not changing the channel, just the name. Well, I am coming to you today, which I know I said I wouldn't update you until Thursday. My doctor's appointment hit a heartbeat, but I'm not saying I got sick. Saturday I went out and I showed you I got my nails done. I had a baby buy. I got me some new jeans which didn't fit, so it looks like I have to go a size up. I got me some pillows. I got some stuff to get ready to get on the train on the 19th to go to South Carolina to see my family, which I'm ecstatic about. Excuse my appearance. I had a rough Sunday. Well, when I got back home, I noticed that I had a little pain in my hip. But I didn't think much of it. I thought maybe I slept on it wrong. As you know, I sleep in the living room. There is a pull-out bed in the living room, and I sleep out here. Because it's closer to the bathroom, because that's where I'm at most of the night, up to the bathroom, and versus getting up out of bed, coming all the way down the hallway, get to the bathroom, going all the way back. I'd rather be closer because it's easier on me. So come about 1 o'clock Sunday morning. I'm sorry, I noticed the pain Saturday. I didn't think nothing of it. But come 1 o'clock Sunday morning, I get up and my left groin to my hip is swollen and the pain is more intense, and I'm like, I said, well, that's maybe not good. I said, well, let's see how it goes. So long story short, I ended up going to the emergency room. I got there, got in the back. I explained to them that, the pain was just a little small pain at once. That something that you just noticed, wasn't nothing that was serious. And then when I woke up, one something in the morning, I realized that I was swollen. And to me, that's a sudden onset because it went from pain to swelling in a matter of hours. So I was like, yeah, this is something that need to be checked out. I let them know that I was pregnant. I told them that I was around 11 weeks. I was supposed to spend 10 weeks and 4 days. Excuse me. I just tried to eat something this morning, and I don't think it's going to stay down. So, my blood pressure was really high. My blood pressure was 198 over 103. Now, I do have high blood pressure, and yes, I take my blood pressure medicine every single day. I could not stress to them, I take it every day. I don't want preeclampsia yet. I don't want anything to happen to the baby. Even though you can still get preeclampsia this early on in the pregnancy, but I don't want it, period. So I was kind of shocked at how high my blood pressure was, because they asked me, did you take your medicine? I said yes. If I would have had my bottle with me, I would have said, look, you could count it yourself. You can see I take my medicine every single day. No questions asked. So, of course, they was pretty packed, and she was like, once we get a bed available, we'll get you in the back. And everybody I was texting was like, if your blood pressure that high, you're not in the back, that's the wrong hospital to be at. But my blood pressure, when I used to go there, used to be pretty high, so they're used to it being that way. And I wasn't feeling I did get a slight headache, but nothing serious. But I wasn't feeling no different. So, the pain was starting to shoot, around my back and up my thigh. I mean, up my hip more. And the swelling was getting worse. And I was like, oh my gosh, this is really hurting me. So, about 2 hours of waiting, they finally called me in the back. I get in the back. I explained to them. They was like, well, how far along are you? And, all that other kind of good stuff there. I told them around 11 weeks. Now, they took my blood pressure and I got in the back. I'm sorry. My blood pressure when I got in the back was 214 over 130. Yeah, extremely high. killer high. My first blood pressure, 198, was killer high as well. So, and my blood pressure, I don't know why it runs so high. When I try, it's not my diet. I'm barely eating as I can, and it's not I'm eating a whole bunch of salt or nothing like that. It's just I don't know why. Maybe it's my weight. Um, that's all I can say. Other than that, some days it's good, some days it's bad. When I went to my doctor on Tuesday, it was 130 over, I think it was 90, which is, they consider that fine for me. So to get a 214 out of 130 when it went up, and I told him, I said my blood pressure's probably up because I'm in pain. Um, so the lady took my urine. Of course, they did the urine pregnancy test because they can't just go by your word. They was like, well, have you seen a doctor for your pregnancy? And if they were looking at records for the hospital, they would have seen that I was there the 6th of February, I mean the 6th of January for ultrasound, which showed that it was an interuterine pregnancy with a heartbeat. But she still took it, and she came back and she was like, well, how far do you say you was again? I said 11 weeks. Now, I'm going to tell you the reason why she asked that question. When I was at the nail shop and I got my nails done, I brought a pregnancy test from Dollar Tree, and I took it. I was very surprised at how light the line was, how faint it was. And I'm like, well, shouldn't it be dark for me to be this far along? But it actually was faint. And then I read that the higher your HCG level, the fainter your line will get, because the pregnancy test is not meant to pick up really high concentrations of HCG. So that's probably why, most likely, she said what she said. And then she probably went to the doctor and was like, well, yeah, her pregnancy test is positive, but the line is light. It don't look like she's 11 weeks. Could be in the beginning of her pregnancy type deal. Then the doctor that was there, he seen me before, and he obviously didn't want to see me again. He seen me before when I went to the emergency room when I was 4.5 weeks, because I was having a lot of stomach spasms and cramps. Turns out I had gastritis, and I guess obviously he seen my name that was on the board, and he didn't want to see me. So what he did was have them put me on a monitor, and he walked around until 7 o'clock shift change. But it was a blessing, because the doctor that I got was a female doctor that I did see before, and she's very sweet and she's very thorough. So I really enjoyed the fact that he did that for me, because and God put the doctor that was best for me in my care, and she really was. I was in the emergency room from 2 a.m. to 4 p.m. So I was there for about 14 hours. I was there for a long time and was ready to come home. That's why I said excuse my appearance, because I've been asleep nonstop. That's all I could do. So let's get into the emergency room visit. They came in, took my blood. She said because of what my pain was, I had to get the pelvic exam. I had to get the ultrasound, which I was so happy for. And everything was going good, as far as me just sitting there waiting for things to happen, because like I said, it was shift change. All the nurses had to come in and, give their report on their patients, and then let them know who was next, who was first, and stuff like that. In the midst of this, they took my blood pressure again. It was 230 over 131. So now I'm bawling my eyes out, because my blood pressure is constantly going up. I'm trying not to cry now, because the mindset that I was in at that time was just, I don't even know. It was just so bad, because I was so worried. And it wasn't even worried about me. It's the fact I'm in pain, and I'm not worried about me. I was worried about my baby. I'm trying not to cry, so excuse me. So my blood pressure is going up. It's not coming down. And I'm like, oh my God, what is wrong? And excuse me. And I'm crying. I hear the doctors back there talking about preeclampsia, and I'm like, you're not supposed to get this early in pregnancy. What are they talking about? And they was like, you see that lady's blood pressure? And my room was 36, so I knew they was talking about me. He was like, you see her blood pressure? They was like, yeah, and she pregnant. And I'm listening to this conversation while I'm crying, and they was like, oh. And then they just silence, and I'm like, oh my God. And this is a little bit before the doctor came in to see me. And she was like, honey, we need to give you something for your blood pressure to bring you down now. So they gave me some for my blood pressure. My blood pressure dropped to 169 over 103. Still not good enough for the doctor. So she came in, did a pelvic exam. She said everything looked good. I had some discharge, but she said that's normal. She asked if I wanted to get tested for STDs. I said, go ahead. I already had it done anyway, so I know I'm good. So I was like, go ahead. It would ease their mind to rule out anything else. So go ahead. She said my cervix was perfect, was closed, nothing was wrong, no bleeding. She said if I get any spotting, it's probably because of what they did. But other than that, I shouldn't get anything, which I haven't. So then she ordered an IV, and I was like, do I have to get an IV? I was like, my bladder is full, so do I really need an IV? She was like, yeah. She said, 'cause I have to give you some blood pressure medicine, so you need an IV. So I was like, shoot, because the IV needle, I have tough skin, and the IV needle, what it normally gets me, hurts seriously. It's a very painful situation. So the woman came in, gave my IV. I'm on my fluids, which was amazing that after some fluids, I was feeling wonderful. I was joking with the doctor. I was joking with the nurse. I was like, oh, this woman is fine. Even though I was still in pain, my blood pressure was still up. I was feeling wonderful. So maybe I was missing some fluids that I needed. Turns out, from my blood work, what came back really, really, really low was my magnesium. And my magnesium came back at 1.1. Which I'm glad I went into the hospital because from what I read on my forms that they released me with, magnesium under 1.0, magnesium 1.0 and under causes serious problems. So I was right at that level. So the man came in. My nurse was a man. His name was Steve. He was really sweet too. I really had some sweet doctors and nurses, so I'm not going to complain about having to wait. Even though that at that moment I was bawling my eyes out, thinking that my baby. I'm not going to lie, thinking my baby was dead, thinking that my blood pressure was affecting my baby. I got the best doctors and the best nurse that could ever take care of me in the hospital. So I got some magnesium through IV. So that was good because she said it was very low. So, on to the ultrasound. I went because I had to get my little embolism, as they call it, to make sure that my bladder was full. And I'm in the ultrasound room and I'm waiting. The lady came in. She was real nice. She was like, well, I'm going to let you know you're going to be in here for an hour. Because they wanted an ultrasound of, everything from top to bottom as far as my stomach on down and my uterus to check on the baby. And she said that I can't tell you anything. She said it's going to be hard to see a baby at your stage of pregnancy. And I'm just like, hold on, I've seen things before. I'm thinking to myself, like, I've seen things before. So it shouldn't be hard to see anything. She said, if I see a baby, I'll turn the screen and let you see it. But other than that, that's all I can do. I can't say nothing to you. So I was like, here we go. And she put the probe on. And I didn't see anything. My bladder, she said, oh, you're really full. My bladder was full. As in full. Like the first thing on the screen, this was my bladder. And as she was going to, look around, I didn't see anything. So I was getting worried. And then when she was pressing in further to my uterus, I seen something, but I couldn't really make out what it was. And then when I seen it, you normally see cardiac activity with a baby. I didn't see no cardiac activity, so now I'm worried. She's not saying a damn thing. And finally, after like over 60 pictures later, she said, the heartbeat is 165. And I was like, oh, I said, thank you. That's all I could say. I was like, thank you. Because she asked me, she was like, well, how many pregnancies have you had? I said 6. She said, how many live births? I said, none. She was like, so I said they were all miscarriages. She was like, oh. I told her about my tubal. And she was like, do you know which side it was on? I said, no. So I'm guessing because I told her my history and everything, she She relieved me some. And she was like, the heart rate is 165. And I just told her thank you, because she didn't have to say anything technically, and I would have to wait the hours and hours and hours. And she turned the screen around and she showed me the baby, and I'll show you, ladies. I couldn't get no pictures because it was, of course, it was a emergency situation. And when she finished the OB part of the ultrasound, I asked her. I said, "Well," I asked her how far the baby measured. She was like, "Well," I said, "I know you can't tell me, but is it on track?" Or she said, "Whatever due date they gave you is a due date that you are." So I'm like, my due date is supposed to be August 24th, but the baby measures August 27th, and my doctor's office said they was gonna keep August 24th because that's when my last period was. It goes with my last period, November the 17th. So the baby was, not behind, but developmentally, I could have ovulated later and stuff like that. So, they weren't worried about it. All my numbers was great, heart rate good. And after a certain amount of weeks, your numbers don't really count. It's, the heart rate and the growth of the baby. So she didn't really say anything, and I looked at the screen, and I asked her, I said, "Well, I know you can't give me no pictures, but can I pretty please take a picture with my phone of that picture?" And she said, "Unfortunately, no. I'm not allowed for you to let you do that." So she was like, "I want you to change so we could do your abdominal ultrasound, and I'll come back." She left the pictures up on the screen. She left the measurements, the due date, the heart rate. I think she did that because it's a way of me getting the information I want to know without her getting in trouble. So, ladies, and just to let you know, baby's 11 weeks, measuring 11 weeks exactly. Today I'm 11 weeks 1 day. So, when I went into the emergency room, I was supposed to have been by my my due date of August 27th, because that's what the baby was measuring in the beginning. 10 weeks 4 days. So the baby is ahead 3 days. I'm actually 11 weeks 1 day today. So hopefully you can see it. That's baby. See arms and legs. I know it's probably not a good picture. Heart rate 165. Yeah, that's the little man, little lady laying in there asleep. Look, they were asleep. Because when she showed me, look, they were asleep. They didn't move. But they didn't have a heart rate. And so I'm ecstatic. My official due date is August 24th, and the baby has grew to that date. Back to me. So that was my main concern of the whole visit. Not even myself. So I get back to my room, and I'm knocked out because I'm tired. By this time, it's like 10, 11 o'clock, and I've been in the back for about 5, 6 hours. And I'm asleep. I asked if I could get some water. They said no, nothing by mouth. I didn't know why. Doctor came in and said, "Well, you need to see a surgeon." I'm like, "Oh God, why did I see a surgeon?" Because they couldn't find my appendix on the ultrasound. Couldn't find my appendix. She said it's normal to find the appendix, but with you being pregnant and where your pain is, we need to make sure we know where your appendix is and what it's looking like. So she was like, "I've talked to your OB. They did talk to my cardiologist that I'm seeing for this pregnant for my high blood pressure period, but he's treating me with my high blood pressure while I'm pregnant as well too to help keep my high blood pressure down." She said, and I talked to the surgeon. She said, "We all agree that you need to have a CAT scan." Now, as you ladies know, you're not supposed to have a CAT scan when you're pregnant because of the radiation. So she was like, honestly speaking, she was like, "You're really at the end of your first trimester." She said, "There's not much that can really, do to harm your baby. But, we want you to know the risk and benefits of the procedure." She was like, "Honestly, the benefits outweigh the risk because if you're not healthy, baby's not healthy." And I was like, "Okay, I understand." So I went ahead and signed the consent because they can't do it if you're pregnant. But I did sign the consent. The surgeon came in. He pressed on me. Um, he told me I needed a CAT scan, and I signed the consent. I told him yeah I agreed, and I knew my risk. So after that, my blood pressure had shot up to 174 over 98. Um, Probably because I was pressed on, and then I was worried about the CAT scan. Because I called my mom. My mom was like, "What do you?" She was like, "Call your OB doctor and find out what they say." I said, "They called her, and she agrees that I need to have a CAT scan done because it will benefit me better to know if I have appendicitis because I need to have the surgery right away." And she was like, "Okay." She was like, um, "Let me know what they say." So I had to drink that nasty stuff because I'm allergic to the contrast dye. And it was nasty, but I'm not gonna lie, I was looking forward to something that had water. I was that thirsty. This was after 6 or some odd hours of nothing to drink. 6 to 7 hours of nothing to drink, my mouth, nothing. So I got more blood pressure medicine. I got Zofran to help keep it down. And I went for my CAT scan. Excuse me, I'm sorry about that. And it was so sweet because they was like, "Wait a minute, don't put her on the table." And I'm like, "Why am I not getting this done?" They was like, "You have a phone call." I have a phone call. So I'm like, "Hello, who's calling me at the hospital?" They gave me the phone. It was the radiologist. The radiologist that will be looking at my test, it was him. Now, I've never talked to a radiologist before. He called me to reassure me. He gave me the numbers as far as what could possibly go wrong with the baby. He said you got a 1.25 chance out of 100,000, or is it a million? It was somewhere in that statistic area. He gave me the statistics of what could go wrong with the baby, especially how far along I was. He said, "We're not ruling out that anything can happen," but he said, as far as we know, studies show that there's nothing has happened to a fetus that has been through a CAT scan at your stage of pregnancy. And he just kept saying, "Do you agree? Are you okay? Is there any more questions? Do you understand?" He was really sweet. He took the time out to give me statistics, the studies about CAT scans. He was really sweet because he didn't have to do that. Because once I signed that form to get one, it wasn't their concern anymore. I signed the form. But he called me and talked to me for about 2 or 3 minutes to reassure me everything was fine. Had a CAT scan done, went back to my room, went to sleep. I'm in there, knocked out, snoring. It's about 3 o'clock. The doctor comes in, and she was like, "Well," she said, "good news is your appendix look fine. You can go home." She said, "We found some cysts on your ovary, which is on my left ovary where I ovulated from. I have a 2.3 and a 3.2. Cyst that they should be." She said my OB will be will be the one to deal with those. They'll send the findings to her, and she'll be the one to follow me up with those. And she said, other than that, she said sometimes when you ligament stretch in pregnancy, it can cause swelling and be uncomfortable. So it could be at my round ligaments is stretching, causing the swelling and pain or uncomfortability. And she's like, "There's another thing I'm going to tell you." She said, "Do you have any back pain?" I said, "Yeah, I have back pain, but I just thought that it contributed to the pregnancy." She said, "No, you have a herniated disc." I was like, "A herniated disc in my back?" She was like, "Yeah." She was like, "We put that in there as part of your findings." She said, "You could let your doctor know too, so he could be looked at about that." I'm like, "Okay." I was like, "All right." So I ended up finding out something that I did not know, that I had a herniated disc in my back, which would explain why when I was looking for the baby's heartbeat and I went to get up, ow, that really hurt. And I went to get up, I couldn't. It was like I went to get up, and it took so long for me to stretch out, and I was like, "Oh my God, it hurts so bad." And how when I sit up like I'm sitting up now, my back is hurting me now because I've been sitting up a little bit too long. I thought it was because of the pregnancy. I never knew because I had a herniated disc, and I don't know how long I've had it. It's not the first CAT scan I've had that no one has ever said anything about a herniated disc in my back. So, who knows? But, yeah. And she said the baby looks fine. and just go home and rest. So I probably won't be doing a lot. Maybe that's why when I walk a lot, my back starts hurting. I need to sit down. Um, so that was my visit. I go to my cardiologist today. He wants to see me today. And it's weird because it's raining cats and dogs outside, literally. And it's supposed to snow. The snow is supposed to start at 7 o'clock. It's now going on 8. I think it's too warm to snow, but I really think it's going to be pretty cold and rainy today. And I'd rather go out in rain than to go out in snow and ice. So I will go to my cardiologist because he needs to tweak my medication again. And that's what he want to do. So he wants to see me today. I gotta call the office and let them know I was in the emergency room, and they talked to the doctor. The doctor wants to see me in his office today. So I'm gonna do that first thing in the morning to see what time I can get in there, because I want to get in as early as possible to be able to get out and be able to get back home. I will be stopping by the hospital to get my ultrasound pictures because she said 24 hours after the test, which would be today, because I had to test them about 6 in the morning, I think. She said about 24 hours, 6 or 7 or something like that. After the test, they'll be able to release my ultrasound pictures. And she said just come into outpatient and ask for the OB portion of your ultrasound that you had done today. So I'm grateful for that information because I really want the pictures. I sent the picture to my mom. And so I'm calling. I said, "Mom, did you see the baby?" She was like, "Yeah." She said, "That's the baby in the middle." I was like, "Yeah." She said, "Wow." I said, "Yeah, isn't it amazing how fast they grew?" I said, "He got arms and legs." You see the arms and legs sticking up in the air. So, all right, ladies. On that note, I'm gonna show you another picture of my little lady or man. Don't know yet. Looks like I probably should be able to find out soon. And the thing at the end that you may see that's lighter is the arrow, because she measured from the crown to rump, and that's the arrow. It's not the PP. See, that's the baby. So, alright ladies, thank you for listening, and sorry for another 30-minute video, but I had a long experience at the emergency room. Alright, I will talk to you guys later. I will get back on here Thursday after my appointment. Alright, ladies. Bye.